When patients and families come here, they trust us to take care of them and to get them to a point where they can move on to the next step. My name is Carla Cody. I'm the Chief Executive Officer at Post-Acute Lufkin. This hospital is meant for patients that are critically ill, long-term acute care, ventilators, wounds. We are a step before going to inpatient rehab or home with the care of family.
I am Dr. Biobui. We will be the main hospitalist providing care for post-acute care hospital. The goal of long term is we will return that patient back to their baseline, and we have physical therapy, we have wound care, we have all of the specialists support the patient. We can provide the long term, and we can provide all of the specialist care, pulmonologists, gastroenterologists, surgeon, vascular surgeon. And when we return a patient back to their baseline or back to their life, then we'll feel very rewarded. And it's not only for ourselves, it's for the patient and the patient family.
My name is Ramnath Seshadri Nathan. I go by Ram. I'm an occupational therapist by profession, and at PAM, I'm the director of rehab. We actually go above and beyond what can be done in an LTAC. You will see our therapy department. I have my occupational therapy and my physical therapy team. They work together. We try to attempt to work even with the patients who are on a vent support. We try to help the patient out to see if we can work on the muscles. If any of those muscles are working, we try to provide them with any care possible so that the patient can experience a little bit of normalcy. Try and see that, okay, if I'm able to get into the chair, maybe I'll get better enough to get up and walk. The satisfaction of doing something like that, it's unbelievable. That satisfaction is completely unexplainable. It's something we live for.
My name is Janice, and I'm the wound care coordinator at Post-Acute Medical. We have very sick patients. We have patients come in with diabetic wounds. We have patients that come in with bed sores. They've been bedridden for a long time. Of course, patients that come in with respiratory issues. And sometimes it's those respiratory issues and the patient's inability to sit in any specific way that causes the wounds. So we all have to work together to maintain that balance and keep our patients' nutrition up, and I work very closely with therapy to get our patients up and moving. You get them off of it, you get them moving, you get them back up and as close to what they were before they ever got sick. It's fabulous to see some of these patients that are the sickest of the sick, that you thought, oh my gosh, I don't know how, but that patient walked out of the hospital. It's absolutely amazing.